After the hour, and this morning we need to talk about health for your heart. There's a new program at Hanover Regional Medical Center that's giving more patients the chance at a longer life.
The program revolved around heart valve disease. It's a condition that goes undiagnosed and untreated in a third of all cases. Well, Carolina in the Morning's Caitlin Stansel live from the hospital with more on how this could change things. Caitlin.
Good morning, Kim and Bob. Heart valve disease affects nearly 5 million Americans every year, and many times it goes undiagnosed and untreated. But New Hanover Regional Medical Center, it has a new program revolving around this heart valve disease. And I have one of the cardiologists here with me, Dr. Janik, talking about, what is this disease all about and why are a lot of cases potentially life-threatening?
Well, that's right. I think a lot of our viewers are aware that the heart is a pump circulating blood to the body each heartbeat. But I think a lot of people are unaware that there are 4 valves in the heart that need to open and close with each heartbeat, both opening to allow the blood to flow forward and then closing to prevent it from flowing backwards. There are problems that can come from those valves, valve disease, which would involve either of trouble with the valve opening, which would be called stenosis or a blockage in the blood flow, or those valves can fail to close properly and leak and allow blood to flow backwards. Either of those troubles can cause symptoms and difficulties with people, and a lot of people are unaware until that's really an advanced problem threatening their life or giving them symptoms and trouble.
Now, what are some of those symptoms that people can look out for?
That's right. Commonly, the valve disease will be discovered by the exam from their primary physician. They'll hear a murmur and order an ultrasound of the heart, where they'll then define which valve has trouble, whether it's opening trouble or leaking trouble, and then commonly refer them to a cardiologist. But sometimes the symptoms are subtle. People can have chest pain, shortness of breath, dizziness, or swelling in the legs, and those are difficult symptoms sometimes to diagnose, but an ultrasound of the heart can kind of tell them if that's from valve disease or something else.
And there are a range of treatment options with this heart valve disease, and we're going to be talking about those coming up later in our show in the next half hour, but stay with us here on Carolina in the Morning. For now, I'm going to send it back to you in the studio.
All right, sounds like something that affects a lot of people. Thanks, Kate.